Hey everyone, this is Hannah with the Rocket Miner. Wanted to give you a quick news update today regarding some changes and new information with COVID-19 and guidelines regarding that. So today, the Centers for Disease Control and Prevention updated their public health guidelines to say that fully vaccinated people no longer have to wear masks in most settings. The CDC is advising that people who are fully vaccinated, who've received both doses of the Pfizer or Moderna or received the Johnson & Johnson vaccine and have that period of usually about 2 weeks after your last dose, that's where you hit the fully vaccinated mark. So they're saying that fully vaccinated people can basically get back to normal and start doing things like normal again without needing to wear masks or social distance in most settings. That includes indoor and outdoor settings and regardless of the crowd size. So there are some exceptions that would be places like doctors' offices or hospitals, nursing homes, also airports or public transportation, places like that. They are still recommending wearing masks in those settings, even if you are vaccinated. But in general, the CDC is saying that for fully vaccinated people, can basically go back to normal now. And of course the CDC also advises that people follow the orders of their local governments or businesses or their workplaces, those places that still have rules regarding mask wearing or social distancing. Obviously the CDC says to continue to follow those guidelines that are in place, but as their general recommendation, they are now giving that approval to say that for fully vaccinated people, it's okay to stop wearing masks, basically go back to life as normal in most settings. Alongside that update today, we also got an update from the Wyoming Department of Health announcing that they are extending Wyoming's statewide COVID-19 public health orders through until the end of the month. So that means that mask use and physical distancing requirements with educational institutions will still be in place to the end of the month. Also, indoor events of more than 500 people are to be held at 50% of venue capacity with specific mask protocols for large indoor events. So these are the public health orders that have already been in place for Wyoming, and they are just extending them once again to the end of the month. And the Wyoming Department of Health is also still recommending masks in indoor public places for people who aren't fully vaccinated when common sense physical distancing can't be maintained among those who don't live in the same household. So basically with the Wyoming Department of Health extending these health orders, it applies specifically to educational institutions, most of which are wrapping up the school year. And then also with large indoor events, they are still recommending that those be limited and not just fully open to full capacity. Those still be limited and with mask use in place for really large ones. And then with their mask recommendations, they also included that caveat of masks being recommended for people who aren't fully vaccinated, which implies that they are in line with the CDC's recommendations that vaccinated people can go without wearing masks now. Obviously both of these announcements came today. I don't know, you never know how long these things have been in the works, or like for the Wyoming Department of Health, I'm sure that they had already made this decision before they saw the CDC's recommendations today. So the timing of that, you don't know how much they influence each other. I think it's interesting that the Department of Health is continuing the public health orders, especially when we're at the same time getting recommendations from the CDC that are actually relaxing things. But one thing to keep in mind when thinking about this with the recommendations and with where Wyoming is at specifically, as I said, for one thing, they probably hadn't seen or didn't know about the CDC's change of recommendations, and also they're looking at specifically what's happening in Wyoming and what's safe and best for Wyoming, and looking at where our cases are at, looking at where our vaccination rates are at. I think that's what went into this decision of extending the health orders. And with that, Wyoming still has one of the lowest rates of vaccination. Right now, it's estimated about 29% of Wyoming's population is vaccinated, but that is still one of the lowest. Wyoming has been seen to have one of the highest rates of vaccine hesitancy among all the states in the nation, and we just don't have as many people getting the vaccine here. Is where our cases are at. Today, we're actually at 516 active cases, so that went back up over 500, which we've been around 400 and staying below the 500 mark for several weeks now. So the fact that we're back up above it even just a little bit is just a sign that the virus is still there, it's still spreading, there are still active cases, we still need to be careful. Also this week there were 2 more deaths added to Wyoming's death total for COVID-related deaths. That brings us to 712. So it's just something to keep in mind that the virus is still out there, it can still spread, it's still a threat and a worry, especially to people who aren't vaccinated. And for people who haven't got the vaccine, you have to remember that even as things continue to relax and we continue to have guidelines like this from the CDC, or even as public health orders from the Wyoming Department of Health change, if you haven't been vaccinated, you can still get COVID, and obviously there are still active cases, it's still spreading. And even if you think that you'll be fine if you get it, that's understandable, but remember that you could still spread it to people who may not be fine if they get it. So as we look at the changes that are happening, as things adjust, as things go back more towards normal, but there continue to be debates about the vaccine, about masks, about all of these things. It continues to be a discussion. We continue to work to understand what's going on and understand what we can do to keep ourselves safe and keep each other safe. But I just want to encourage people to be informed so that you can make your own decisions. I've said this before, but it bears repeating that we need to do good research, look into things, look at multiple perspectives, look at good, credible sources, make sure you're seeing where you're getting your information from, and having good reasons to back up the decisions that you make so that you can make informed decisions. Be respectful of guidelines and orders that are in place with the Wyoming Department of Health extending our public health orders. Be mindful of that, be respectful of that, follow suit, and be just thoughtful about the orders people put in place, and whether that's a business that's still asking people to wear masks inside, or your workplace, or our government. Just be aware of that, know that those are there for good reasons, and be respectful of the rules that are still in place. And then, wherever you're at in this, whether you're vaccinated or not, however you feel about masks, just continue to be kind and be considerate of others. And we make a lot of assumptions these days when we see people, whether we see them wearing a mask or not. Obviously that's going to get a little different now. If most people aren't wearing masks, you don't know if that's because they're vaccinated, so they're following the CDC's guidelines, or because they've never been wearing a mask, and they're not vaccinated and they don't think they need to be. You don't know where people are at. So try not to just make assumptions as soon as you see people. I know it's easy to make assumptions, I know I do it, but I think all of us need to try our best to not just assume that we know where someone's coming from or what their reasons are. If you know people, you can have conversations with them about it, but in general, just be kind and be considerate. Make good informed decisions for yourself, and try to help people you know and love make informed decisions as well. But in general, just be kind and compassionate. Do what you can for you and what you can to protect others, but then don't assume that you know where they're at. So that's just what I wanted to share with you today, just those updates on guidelines and then some of my thoughts on it. So keep checking with us for more news and updates, and I hope everyone has a good night.